Ivan! 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 Ivan!
Be quiet. We want to sleep.
Where is he?
Your husband is at home in bed.
Get him up now.
I can't get him up. I'm in hospital and so are you.
Don't you dare drug him anymore. Just get him up. Oi! Get him up here with me now.
Ask the nurses. And we don't answer to hi. We're not donkeys or asses. You ask the nurses to do it for you. We're patients.
No, you bring him up to me
Ask the
now.
nurse to do it.
Now. 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 Ivan! 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 Ivan!
Oh, hi. I was just wondering if I'm due the antibiotics and the pain relief.
All right, I'll find out.
I think the pivmecillinum is due at 7 a.m. Oh, okay. Will the doctor be coming to speak to me about the MRI and the treatment plan and what's happening?
I'll also find out.
Thank you.
Ivan! Ivan!
Yeah.
Ivan! Ivan!
I'm
Where's my Ivan?
Ivan. It's not here.
Where are we now? Nurse. 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 Please answer me.
All right. Okay.
Where are we now?
I'm Maureen.
Where are we?
Do you know where you are?
No, I don't.
You're in St. James Hospital. Yeah, you're still here.
All I remember is I spoke with a friend of mine,
Okay.
and she said we're going to meet up today.
It must have been a dream because you've been in the hospital for a while.
Is Ivan here?
No, your husband's not here.
Can I get him?
Okay, we'll get him over the phone.
Yeah,
Yeah.
because it's just so going to. She's giving me some drug or other. I don't know what it is.
All right. You must have had a bad dream.
Yeah.
Okay. But you're still here, so just take a deep breath and relax. Is that okay? So you're still in St. James Hospital. Is that okay?
Yeah.
Yeah.
You want to lock me up?
No one's locking you up. It's all right. No one's planning to lock you up.
Have you got anything that has anything like lip cell, dear?
What?
Lip cell.
Left cell. Oh, okay, your lips are dry, right?
Yeah,
I'll have a look for you.
yeah, I
You
can't,
don't have any, do you? I'll have a look.
I can't, can't get anywhere to get anything. I don't know.
Yeah, I know. It's all right. I'll look for. I'll have a look and I'll
Okay.
pick it. Okay? It's all right.
Yeah.
Yeah. So just relax, okay? I'll come give you a wash soon. Is that all right?
Can you me sick as well?
I can give you what?
A seat?
A steak. Oh. I won't be able to do that. Unfortunately.
I mean, I want to know where my husband is. Have you rang his phone?
Like I told you, your husband's at home. You are in the hospital, but we'll see if we can get him on the phone
Oh, yeah.
and probably have a word with you. Is that all right? Okay. So all you need to do right now is just relax. Is that okay? I'm gonna shut the gate down.
Relax without him.
That's why I said I'm gonna get him over the phone. Okay? So you can relax. Because some other patients are still sleeping. And when you shout, you're disturbing them, you're waking them up. And we don't want to do that, do we?
No.
No, good. So I'll be back, okay?
So the patient next to me has got leg sores, and I heard them taking pictures of her leg sores. As for whether they've actually given her any treatment for them, I don't know. But it explains she's obviously in a lot of pain if she's got leg sores and a catheter. So she probably needs something like morphine, to be honest. I just hope that they are treating her leg sores like they should and giving her enough pain relief. And I'm still waiting for mine. They're going to bring it over shortly. So yeah, I have to, I don't really feel like there's been a huge improvement in my symptoms, but I have to wait and see, and hopefully in the next day or so they will improve. But we'll have to wait and see. So yeah, I'm just gonna hopefully go for a walk today outside.
Hello.
Hi,
Hi.
how are you?
My name is Sarah.
Hi.
They say, did you say you got some medication you're supposed
Just antibiotics for the bladder and urothelium infection, pigmecillin.
to? Okay.
I'm supposed to be taking it 3 times a day.
I'll have a look now.
Thank you.
I felt like she thought she slept it. What's your name? Sorry.
Lydia O'Dwyer.
you have your other medication?
I haven't had anything all morning.
Do you want paracetamol and painkillers as well?
I'd probably rather have something a bit stronger than paracetamol, because my symptoms of bladder inflammation have come back. So probably ibuprofen would be better to have.
Do you want both of them?
Yes. Well, it's not really about what I want. It's more about like what am I supposed to be having antibiotics 3 times a day? Yes to the
I'm just
painkillers,
asking
but then in
for
terms of the antibiotics, I need to take those 3 times a day. So just whenever the antibiotics are due.
Yeah, no, I was just asking for painkillers.
Oh yeah, I'll just have ibuprofen, please.
Oh, do you want you don't want the codeine?
Sorry?
So there's ibuprofen, paracetamol, codeine
Oh, I'll just go for the codeine then,
in the paracetamol.
and the ibuprofen.
Oh, okay, not
Yeah.
paracetamol.
No paracetamol. Yeah. Do you know if the doctor will be coming to speak to me today?
They will be coming
Oh, okay. Just want to find out about the MRI scan.
Yeah.
If the radiology department have accepted the referral for the MRI scan.
They'll be doing the rounds.
And also urogynecology, whether their consultant from urogynecology is going to give their clinical opinion.
I don't know if the referral's been done. then
It
they-
has. Dr. Paul made the referral for the MRI and to get a clinical opinion from urogynecology.
Yeah. So they will.
So hopefully they'll get back to us about whether they've accepted it. But I know it's the weekend now, so it might be a bit slower.
What's your birthday?
It's the 14th of October 1994.
Nurse,
Hello. You okay?
no, I'm not.
I'm coming around.
My husband's disappeared.
Oh, is it?
And I don't know where he's gone.
I'll come and talk to you. You take me 10 minutes, Lord.
Yes. Cellerine is the antiseptic,
Yeah.
to sterilise the bladder, and then the methicillin is for cystitis cystica, which Dr. Paul consultant has diagnosed me with. I don't know based on what tests. And then I was diagnosed by Dr. Maloney with urothelium and bladder infection. So I think the pivmecillinum is for that.
Yeah.
Is for the cystitis cystica. Yeah. Oh, and also antihistamines, because I'm taking the antihistamines
Yeah,
so that I don't
I've
get
got
the
that
adverse
one,
reaction.
yeah. Have you got your stockings?
Yeah, I've got them. Do you know what time breakfast is?
And you should be around.
Now?
Yeah.
Oh, okay.
Yes,
Has Mum taken any notice of me?
I am listening. I'm coming to you shortly.
There you go.
My
Oh,
name is
thank you.
Sarah, by the way.
Thank you. I am Lydia. That is my name.
Should be around.
Thank you. So we've got in here the ibuprofen, phenamine, codeine, and then the antibiotic.
Yeah.
Thank you.
Hello, young lady.
Not so young.
Morning, would you like a drink, love?
What's the matter?
Yes, please. Could I have a coffee?
Yeah, any sugar?
No, thank you.
No,
Just
milk,
milk.
yeah. And what would
Yeah,
you like
just
for
milk.
breakfast?
Oh, porridge and toast,
Porridge.
please.
Right.
Yeah, thank you.
I mean,
Hmm?
one, two,
Yeah, let's cover your bottom.
they're, I'm meeting with a girlfriend.
Hey, where did you go?
Don't know.
Thank you.
The drugs available.
Are you sure?
Are you having a drink, love?
Please, yeah.
Tea, coffee,
Coffee, please.
sugar?
No, thank you. I'm just so delighted to get back in. I don't even know how I got back here.
What do you mean?
It's gone from my life, is that? Thank you.
You're welcome. Megan, are you having anything to drink, love? Megan, would you like any breakfast or anything to drink?
sugar on.
Hi. Oh, in the porridge, yes, please. Could I have jam actually, if that's
I've got
okay?
some jam, yeah.
Yeah, jam would be
Got
great.
sugar as well.
In the porridge, yeah, but not in the cereal, not in the toast. Just in the porridge.
There you go.
Thank you.
You having any toast?
Yes, please.
How
That'd be
many?
great.
One or two?
Just 2, please.
Two with jam.
2 with jam. That'd be great.
There we go.
Thank you.
Morning. Having some breakfast?
No, thank you.
You don't want anything, okay.
I'm not having breakfast.
You don't want no cereal? Or some porridge? You want a biscuit? We'll get you some biscuits.
Oh,
Yeah.
thank you.
I'll bring you some back. Get some biscuits. Today, do you want some soup for your lunch? Or apple juice? Some soup?
Soup,
Yeah.
Like a drink, love.
Do you want a pizza,
Coffee or tea?
beans
Sugar.
on toast,
Milk,
or
yeah.
a jacket potato?
beans and toast.
Do you want a vanilla ice cream?
You want that?
A vanilla ice cream.
Oh, please.
Yeah. Then we've got potato top chicken pie, shredded chicken in orange and ginger sauce, or a vegan sausage roll. It is. Marmalade or jam? No. Do you want the potato top chicken pie?
Yes.
Yeah. Do you want some gravy on?
Please, yes.
Do you want some chips?
Yes.
Do you want any green beans or sweet corn?
No, not sure. I'm sure.
Rice pudding?
Yes.
All right, love.
Uh,
Yeah.
Yeah, some Rice Krispies,
What?
love.
Where's my husband?
Is it?
Is he at home?
I think so.
Can you find out for me?
I will.
Right, young
That
lady,
is-
we've got you to take some tablets, okay?
Megan didn't want out, she's just got a drink, but that one, I'm doing it now, she wants a slice to.
You and me. Oh, you've got yours.
Yeah, I've done everybody, apart from side room, that they didn't want anything.
Right.
I'll,
Somebody's shouting slightly.
Yeah, I know.
Oh, she wants cornflakes. This is ready.
Can I have a look at your wristband? What's your full name?
Maureen Jackson,
When were you born, Maureen?
18th August, 07.
Jam or marmalade? I am, love you.
That's it. I've got some medication for you here, Maureen. Got some antibiotics.
Oh, so,
Antibiotics to get you better. Yeah.
don't know whether they're better, I
Well, we've got to try, haven't we?
don't know. I don't know how the hell I ended up here.
Right,
I
let's
don't
take those first, then we can talk about it.
I mean, I do know how I ended up, I don't know.
Right, got a drink for you.
Would you like a drink, love?
That's it. Careful. Is that gone? Got to swallow it. Have a drink to swallow it. Right, drink up. Drink a bit more.
I haven't got a tablet.
Yeah, got another one. Your husband is at home, you know. He'll come and see you today.
Or at got to use the lip balm.
There's nothing, really.
No, you go
I'm
ahead.
coming
Go ahead
back.
with that. Go ahead, I'll put it right on your table, okay?
A strong painkiller, please.
Have you taken the head one? Yeah. You need to swallow them with the drink.
Where's the put on the wall? Where's the put on the wall? Yeah, yes, definitely.
Right, you got to take this one.
Pain relief, come on, please.
I just finished with this lady, then I'll come to
It
you.
was taking a long time. The time is now and there's severe pain here. I should have 8 o'clock early last night.
Right, that's fine.
Need to keep track of the pivmecillinum. I'm supposed to have it 3 times a day.
Have a drink.
So I need to have another one at 2 o'clock and then another one at 10 o'clock.
No.
I reported on this I realised what's causing the back pain. It's the methenamine hyperate, the Hyprex, which is widely prescribed, but in the documents about it, it says it causes back pain. So now I know. Just suddenly had that realisation. Now I know why I'm getting back pain. It's the methenamine hyperate, the Hyprex.
What are you looking for? Let me sit you up so we can. You're looking for water?
Let's sit you up, then you can have the water.
Porridge is really good for you first thing in the
I'm
morning.
just gonna sit you up,
It's
alright?
got loads of oats.
She got a sliding machine. That's this mattress.
You're in my husband.
Sorry?
You're in my husband.
Move closer.
Finding for
I
me.
wish my brother would come and visit me, or one of my ex-lovers, or one of my family friends. Now I'm not having an adverse reaction to the pivmecillinum like I was when my mum visited me. Now I'm on the antihistamines. In fact, did they give me the antihistamines just then? I don't think they did.
I'm on my way.
I don't think they did give me the antihistamines, so I need to
I'm
ask them
on
that,
my
otherwise I'm going
way.
to have another adverse reaction. Excuse me. Oh, sorry. I was just given the antibiotics, but I don't think I was given the antihistamines because I have an adverse reaction to the antibiotics if I don't have the antihistamines with them.
I've given you the yellow little tablet. That's the antihistamine.
Oh, you gave me the antihistamine. Okay,
Yeah.
sorry, I didn't realise. Thank you.
We're gonna get you off the bed, okay?
No, I'm not ready to get out of here.
No, you're not getting out of bed. We're just moving you up the bed, alright? Yeah, just moving you, just getting
Come
you
over to me.
comfortable. You can take a
Roll
pillow.
over to me.
Yeah, just to get you comfortable.
Right, Maureen. Hold on here.
What's happening there?
find it funny how even the elderly have catheters and leg ulcers
Your
and
husband is at home.
spend months in hospital with
Well,
husbands.
you'll be coming this
And then there's
afternoon.
me, who's like 31, doesn't yet have those things.
Right, let's
Has never
go.
even had a serious relationship.
It's alright, it's alright.
I find it really funny.
Hold on to the real here.
But you know what? All hats off to Maureen, because she's obviously must be a very excellent wife to her husband.
So we'll move you up.
Okay, just put your hand on your chest, alright? Put your hand
I
on
do
your
roll.
chest.
Move you up. Up, no, you're not getting you out.
Put my hands on the tip of my
Yes, on your chest, please. Ready. Okay.
She's probably a very loving woman,
Ow!
Alright.
How
very patient, very
It hurts tonight, really.
Alright.
humorous.
Ow!
It's okay. We're almost done, okay? We're almost done.
Ow!
Wait.
What's going on?
Ow!
She's in so much pain.
Ow!
Sorry, Maureen.
Ow! Don't do that. It hurts.
Right, just go.
No, I'm not going anywhere.
Yeah. We're just going to need to remove this. Right.
Good.
Sorry, Maureen. We're done already.
Have you done?
Yeah, we're done.
Yeah. You're at the bed now.
I have a
Okay.
pillow so we can put it in.
At least I've got some shortbread.
That's right.
Oh,
My
I
mum
got
bought me
you
the
early,
shortbread.
didn't you?
I'm forward.
And I didn't realise, but it's not just plain shortbread, it's got chocolate chips and toffee.
It's John 20 now.
Well, that's nice.
Put it on the. Yes.
Enjoy that with my
Push it in.
cup of coffee here.
Yeah, exactly in the same place.
I'll get some biscuits there and I'll bring them back.
I really need to get some tips off Maureen. I need to say, Maureen, how have you been married all of these years? How have you managed to find a man who will actually come and visit you whilst you're in hospital?
Oh, she was asking for.
You alright?
Yeah, I'm fine. I'm just eating my
Press the
breakfast.
buzzer.
Did I? Oh yeah, it was because of the fact that I was wondering if I'd been given the antihistamines with the antibiotics. Yeah.
Okay.
The lid of the jug is falling off. I mean, it's just like I'm ill. I have a really bad infection. It's come back as positive in the test results. I'm vulnerable, I'm ill. I'm not great fun to be around, you know, because I've been ill for a long time, but Maureen still has her husband visiting her, so why don't I? I haven't committed any crimes. I haven't hurt anyone. I'm being honest, I'm being vulnerable, so wouldn't it be lovely if my son could be brought in to come and visit me as well? The woman across the ward from me, she had her little boy visiting her, who must have been about maybe 4 or 5. And then in the wall on that side, the elderly man who's got his own room, he also had his like wife or daughter with her baby, newborn baby. I saw through the window. And that is why my YouTube slogan is, all that is done in the dark will come to the light. Because all the reasons as to why people like this end up in hospital, they will all come to the light one day. Until then, you just have to keep a smile on your face, stay positive, stay strong, and just be grateful for what you have. Because things that one person have, another person doesn't have, and things that another person doesn't have, one person does have. There's no point in playing the compare game, really, is there? Because you just never know what's going on in someone's life. You just never know. You just have to express gratitude for what you do have. And be mindful, present in the moment. So, on that note, I'm going to have a short word. But I have not been out to buy any food yesterday, and I've not been out to buy any food the day before. Just what my mum bought me. Shortbread, Scottish shortbread. Morning. I spoke to her yesterday. And I know a lot of people might look at this ward might look at me and think she's so lucky, like she's in such a better position than I am, but I've never been married, I've never had my children live with me. There's so many things I haven't done that a lot of these ladies will have experienced in their lives. You know, like bringing their baby home from the hospital. I've never got to have that experience. And that is, it ends up, a lot of mums ending up in the hospital after something like that. So like I say, there's no point in playing the compare game. Because you just never know what battles somebody is facing. Or how hard they've fought to have what they have and keep it. So it was just a thought. It was just an observation. But hey, who needs friends and visitors when you've got YouTube, who will see these videos forever and ever and ever? The hospital diaries. Mama Lydia's hospital diaries. Mama Lydia tries to get her bladder and urothelium infection cured. Mama Lydia tries to get her urogynecological issues resolved after years of suffering. Stay tuned. Right. I'm not going to have more than 2 biscuits on camera, because then rightfully so, people are going to look at me and they're going to say, you're not taking this seriously, you've got a weight problem, why are you having biscuits? So they're right. That is partly why I'm here, although not entirely why I'm here. And so I'm going to put away the biscuits for now. I've had 2. That's enough. And now I think I'm just waiting for information about whether the high ALT of 58
which could indicate liver issues, might be investigated. Whether there'll be a repeat check for proteinuria and whether that will be investigated.
Some digestives, some
And
ginger
then
ones.
the MRI scan and whether that will
Which
go
you
ahead,
want me to open for you?
because that would show up any bladder inflammation. It's really effective. It's got a specific name which I'm going to look up.
There you go, love.
And then
You all right for leaving
whether the
there,
referral to urogynecology
you can
has
get
been
the card, yeah.
accepted, and whether they'll give a clinical opinion
Yeah,
on what they
it'll
think
be
about the
your own water.
pivmosinamab,
I'll
and do
ask
like the
them to
correct
check for you.
tests they need to do to check for
I
urogynecological
will, I'll ask
infections.
them.
And then whether I'll have like a repeat blood test or repeat samples, or because it's the weekend, I think that a lot of the doctors won't be working. So I'll probably have to just sort of hold tight now till Monday, and maybe that's a good thing because I'll just be sort of having the antibiotics, and by Monday I'll know if I feel any different. At the moment I can't say I've noticed a difference with them. In terms of blockage that I feel in my urinary tract, I can't say I feel any difference. But there is definitely a difference in terms of months ago when I was at home and I didn't have the pain relief and I didn't have a nice environment. It was just like constantly having to get up and go over and over again, and it was just horrible and horrendous. At least it's not like that now. They've sort of like, they're managing the symptoms, which is good with pain relief and stuff. But I just really want I want it to be cured, you know, because although I do sometimes think it's down to the weight, I've been watching My 600-Pound Life recently, and the people there are all American. They got up to 950 pounds, and they are not having to get up every minute to use the bathroom. So although I know there's lots of symptoms that are associated with having a high BMI and obese BMI, but at the same time I don't think that in and of itself you can put it down to the weight. So I just want to make sure everything's working properly and get to the root of what's causing all these issues. So hopefully we will eventually. I can feel the sweat dripping down my back. Hello.
I looked off at your clean lid.
Oh, thank you. Are you just going to take the
It's already been done. It's just that you leave it on the floor, so I'll fetch you a
thank you.
clean lid.
I'll get you one when I come back down.
Thank you.
Have you finished? Thank you.
Watch some TV.
All right, thank you.
It's only free till midday, I think. Free until 12 o'clock.
Morning, Sarah.
Hello.
Welcome back.
I know.
Lord. One of the ladies did
26, yeah.
I've got it, yeah, that's what I'm getting it out. wants to come back here, she wants to sit there. So
All right, so I'm getting all the medication.
I will let her know. Thank you.
Yeah, I'm bringing it out there.
Yeah, thank
I'm
you.
just getting the rest.
Yeah. Do you want to go along there, Sarah?
No, thank you.
You want to enjoy the sunshine in the afternoon?
No, thank you.
Okay, say hi to Merlin.
All right.
Yeah, all right.
Yeah. Yeah, can tell you I'm coming. I'm
Yeah,
just
I
getting
will.
all the medication.
Thank you.
Hi, Lydia.
Hi.
Are you okay to sit on the chair so I can change you?
Yeah, of course. Of course I can. Oh. Move over here. Move this table over here.
There's a clean list.
Oh, thank you. Yeah, let me fell on the floor. Thank you. I'll just move my bag off the chair so I can sit on the chair. I'll just sit here. Listen to him. Thank you.
You're welcome.
They probably are quite sweaty because I'm on the medication and also it's very hot.
Yeah,
So,
it
yeah,
is.
probably need to probably need to change a sheet.
It's that time of the year.
Yeah, exactly. It is, it really is, yeah. Are these orthopedic mattresses? Are they orthopedic?
Not orthopedic, but
Because they feel quite supportive, like,
yeah.
I don't know if it's memory foam, but they feel quite supportive when I'm lying on them. Which is nice.
Sure they are orthopedic.
Oh, I forgot it goes up as well, doesn't it? So I can put it
Yeah,
up
it
while
does.
I'm watching TV. Yeah. Oh,
Also,
that's
you
good.
had it flat like this.
Yeah, exactly.
Oh wow.
Yeah, I was very low down. Is there a way also of putting the lower part up so you can like elevate your legs?
Yeah.
Oh, that'd be good.
Oh,
Because
yeah.
I get really painful legs. Oh,
Yeah,
okay.
so you can lift the legs up.
Oh, that's so good. I'm gonna
Yeah.
do that. That's what I need. That's exactly what I need. So the blood flow goes.
Yeah, so it's all there.
Yeah. What time do you finish your shift today?
8 p.m.
8 p.m. Wow, that's a long
It's a
day.
long day.
Yeah,
10 hours.
10 hours. I used to do 10-hour shifts in hospitality.
Oh, okay.
Yeah, I only ever did 9 to 5 when I worked in an office.
Oh.
When I used to do events, on-site events, the waitress, I used to sometimes even work. I think once I did a 16-hour shift.
Wow.
Up in Scotland when I was at university. I'm sure I had to be there for about 6 a.m.
Wow.
And then I didn't finish until about 3 a.m. the next day. Yeah, it was about 16 hours.
Even more if you.
Yeah. Not sure doing that while studying was necessarily the best of ideas.
Yeah.
At
Were you doing
all.
it frequently?
Sorry?
Were you doing that frequently?
Yeah, I was. I
Oh.
was doing it frequently. Yeah. I mean, I wasn't even going out often. Like, a lot of students go out 4 times a week and they need the money for partying. But I only did that in first year, so
Okay.
I don't know what I needed the money for. But I guess I was a student, so maybe I just needed the money.
Yeah.
I don't think I knew how to budget back then.
Mm-hmm.
You know, like set a budget, you've got this much for bills, this much
Yeah.
for bike, vehicle maintenance, this much for
Exactly.
insurance, yeah. Oh, can I get back in now?
Yes, you can.
Oh, thank you.
I'll just put the pillows.
I'm gonna put my legs up. I haven't done that before yet. Yeah, the same so the water's close by.
So you want it that way, right?
Yeah, I just put my legs up. Thank you. Thank you.
I'll put the pillows.
Oh, thank you. It's nice. Oh, it's Ainsley Harriet. From Ready Steady Cook.
All right, it's right up.
Thank you.
Okay then.
Thank you.
You're welcome.
Hello.
Yeah, thank you. I'm exhausted. It's only like 10 a.m.
I know. Feel like it's a long day, don't you? Then.
Yeah, I do feel like it's a long day. Yeah. When you're poorly, the days do go on for a
Yeah,
long
they do.
time, don't they? Yeah.
Surprising how much you sleep as well, isn't it? When
Yeah. Oh my
you're
gosh.
like, 'cause if you were at home, you wouldn't.
Yeah, you
like
wouldn't.
do.
But in a hospital, I went to sleep at about 5 p.m. yesterday. I woke up at 10 p.m. Went to the toilet, came back, fell straight back to sleep, and then woke up at 3 a.m.
So that's what I
slept
mean. You
so,
won't.
so long yesterday. I'm so pleased I could sleep for that long. I really am. I mean, like before when I was at home before coming here, I was like, I literally hadn't slept at all for 6 nights, and before that I was getting like 3 hours a night.
That's it. And then
Yeah. So here I'm sleeping much more.
it's a
which
good
is really
thing
nice.
though, 'cause you'll be catching up on it, won't you?
Yeah, catching up on it.
Yeah.
Yeah,
All right,
exactly.
love.
Thank you. What's your name?
Tracy.
Tracy. Like Tracy Beaker.
Yeah.
I used to love Tracy Beaker.
You know, my daughters were on about that the other day, because when they grew up, it was all that.
Really? Yeah, I loved it. I used to watch it at my childminders. Tracy Beaker.
Yeah.
Yeah. Have you worked at this hospital for long?
30 years.
30 years. Is your title health assistant?
Ward housekeeper. Yeah.
Oh, I see. 30
Yeah.
years. Were you
Started
born
when
in
my
Leeds?
daughter was 3 months old, and she's coming up to 32.
Oh my gosh.
Yeah. I know.
That's amazing.
Tracy. Tracy. You say 30 or 13?
30.
Wow.
I know.
That's a lifetime.
I know. No, I'm just thinking this bit of this side now.
You only do the night.
Get my laptop. Do some life administration. The time has come. I need to charge it first. My my insurance phone. I tried to deliver it yesterday. Of course I wasn't in and I didn't track it in time. They're going to re-deliver it on Monday. Which is such a shame because I really benefited from my phone over the weekend. I'm going to deliver it on Monday. I need to make sure I track it, but the thing is, I just don't know how I'm going to get there on Monday, to be honest. I think it's going to have to be probably later when I'm discharged from hospital. But they won't take it back, they'll just keep trying to deliver it until my phone's ringing. The phone that Sanjida gave me from Women's Whispers, it stopped working and now the SIM's been taken out, but it just keeps ringing at random points. I'm just grateful for everyone's help. Just really grateful. Thank everyone. Out with all this coding. Sorry about the ringing, everyone. It will stop soon.
You want to sit there until it gets dry?
Just remembered I have my appointment, my 3-day appointment with the nurse at 11:15. And I just realised I can do it on my laptop. I thought I was going to have to do it on my phone. I don't even really think I'll need speakers because my headphones are broken.
They have electric court.
Page that online to see if it's
Why have family court judges blame their victims? Don't know, Karen, can you tell me? Judges blame women for being abused in family courts. Why are judges blaming victims in family courts? Court professionals, very often judges, are regularly discrediting or trivialising people's evidence about domestic and sexual abuse during family court cases, according to research. Looking at 91 judgments from women roles. Women bore the brunt of the behaviour and were far more likely to be described as emotional. Others had tiny details in their accounts picked apart. Like when a judge felt the need to draw a distinction between a man holding a knife to his partner's throat versus approaching her with it pointing it at her throat. Hannah Summers, who has been reporting from family courts for 5 years, writes in a piece that she's occasionally seen this behaviour in person, but it more often takes place behind closed doors. As she points out, judges and professionals in court are more likely to moderate their language when they report it than in the room. Interesting. That's why it's so important to get more journalists fully prepared to cover the family courts. Family courts used to be entirely private, with journalists only allowed access in a handful of circumstances after specific applications. When a pilot first opened up courts from the court several years ago, the Bureau helped to train journalists so we could finally see what was going on inside this opaque system. You can access all our advice on family court reporting here.
I look forward to it. I'll be right round to have a lovely visit.
Let's click on it and see what it's about. When I get a spam email that I'm like really interested in, first let's find a link for this appointment. Scroll down and Yahoo. It's so trivial, I don't know. You just like scroll down, you can't seem to click on there. Okay, we found it now. I could have put the appointment for 9 and I'd be ready now, but I can see it decided to look at the news. Great, so I've got the link here. Let's click it. Yeah, so that's in 2 hours. Okay, in 2 hours. Keep it for my reference on this. Okay. Google. This is the Bureau of Investigative Journalism, and I emailed like 15 of the reporters from here, but none of them got back to me. I might try again.
And right now, we've got some great deals. So you can do more of this and this for less. Plus, you'll get the best choice of rooms and hotels. Look now, £60 deposit per person. Nothing beats a Jet 2 holiday.
I want to watch some videos, I think, on how to use this Google Chromebook because I truly don't know.
Hey, welcome back to the episode from these sticky country corkscrewers to simply in a Maltese garden and Ellie's champion cheesecake. And now it's time for my last
Focus space.
with hot maple syrup and creamy I've bashed out my chili
I think I need to just watch like how to use Google Chrome video. I'm just really tired. Stop this recording now.
Flour, processed, beaten egg, and then we put it in a sweet, crunchy breadcrumbs. And this particular taste, not just any old seasoning. I've got garlic,
Must be a logical
in there, and
way to do this.
I put it into my flour. And I'm just going to give that a little bit of a mix through like that. Here you go. That's good. That's beautiful. Okay, that's ready to go. That's ready for our dipping. Next up is our eggs. So I've got a couple of eggs here that I'm just going to crack. I'll put a little bit of water. Okay, just beat those up.
Escape.
Help break down the album a little bit.
So I need like an IT technician husband to just teach me how to do this. I have to just put it off and turn it back on.
Go through that process now.
I'm not done.
Now, chicken breast, starting off with the flour. Okay. Then make sure that you push that down so any exposed piece of meat is coated in that lovely seasoned flour like that. There you go. Then, when that's well floured, pop it into the egg, like that. At this point, you have to be a bit careful because if not, your fingers get very wet with the eggs. Turn that over like that. Alright, you can use a pair of tongs if you like. Can you imagine in the kitchen when we're doing it for hundreds of customers? Maybe with a Scott Noir or something like that. There's hundreds of them. So you do need individual people doing it. You know? You're the flour chef, you're the egg chef, you're the breadcrumb chef. The live chef, but you're the breadcrumb chef. I love that. Okay, shaking that like that. Turning it over and making sure it's well crumbed up. What I like to do is just get a bit of that crumb, sprinkle on top like that, and then give that a bit of a pat. Alright? And I remember my old saucier on dinner used to say, make it look exciting. So I said, how did I do that, chef? I'm going to show you now. Let me just wash my hands.
Well, at least I know my post was collected at 9 o'clock today, so it will be in transit to the laboratory right now.
And I'm
Sweet.
just doing that. So when that goes
How
into the
long
pan,
does post
you get
take
the
to
most
arrive?
wonderful effect.
One collected on a Saturday.
There we are. And that's it. That's all you're doing. And that's perfect. We need to get our pan on now. Over a medium heat. Get some oil in there. Okay. My chicken's in. Okay, it's going to be cooking for about 5 or 6 minutes. For the slaw, I'm just going to quickly put on my maple, hot maple. Ever so simple, guys. What I've got here is a bit of maple syrup. And I'm putting straight into my pan. An American-style hot pepper sauce, cayenne sauce. So it's not like the West Indian hot pepper sauce. Because I'm putting that much hot pepper sauce in there.
What's that? So I went to Google.
I don't know.
Until
Butter's going to add a touch of richness.
Is
Okay, and
delivered
finally, a good
when
squeeze
collected
of lemon juice.
at 9 AM on a Saturday.
That's it. I'm just going to warm that through now, and we're going to be able to drizzle that
So
on top of our beautiful schnitzel when it's cooked. Oh, look at that. That's what I'm talking about. Getting the right temperature. And look at that. There's very little low heat after that.
So it's likely it will arrive on a Wednesday, because it probably wasn't the first class. Well, it could be Monday.
Golden brown. I like it.
So,
It actually originated in York
how long does
Buffalo,
it take to make
Yorkshire schnitzel.
this?
And I think you can go back there today, you're probably still going to find your sort of restaurant that sells those classic things. And it really is so lovely, isn't it? Okay, now what about that ranch dressing? I've got my sour cream here. Big sour cream. I love it. Bit of mayo there too.
So it takes 7 days for them to do the testing. So if it arrives on Wednesday, 7 days of testing, the Thursday, Friday, Monday, Tuesday, Wednesday. So they wouldn't finish that until the Thursday after next. And then Friday, so Monday after that, they'll finish the testing. I should get my results back, not next week, but the week after. No, wait. Rise on Wednesday, 7 days will be the week after that. 3 days processing. So I won't get my result. I won't get my results next week. I probably won't get them the week after, but I might get them the week after that.
Yeah, I can hear you sizzling. I can hear you.
Although it's not an agar and specialised liquid broth culture that they're doing.
Herbs. Just
So
chop it up. That goes straight on top of our
also, I think on Wednesday I'm going to order the GP. I'm going to pay for a clinical advisory letter.
That's it.
Because otherwise it'll be the same situation as before, where nobody knows what to
And
do.
finally, last but not least, just going to crumble it some of that lovely, beautiful. Oh. Okay, that's it. That sauce is done. Over here, I've got my shredded carrot and cabbage. You can do that on your food processing, a little cutter there. All right, and then a bit of celery going in there too. Oh, with a little bit of spring onion.
So that's that. I've got an idea about the time frames there.
Blend that together into a slightly larger bowl. You go. All that's going in there, the celery, the cabbage.
So it'd be really useful if I had someone in Leeds who I could give my house keys to and just say, and I could have just said to them yesterday, please can you just go and wait at home, or even contact my neighbours and say, please can you collect this parcel for me and sign for it, because it's my insurance phone. There was nobody there, so they didn't drop it off. And I need to arrange that for Monday, because if I'm still here on Monday, I urgently need on the second attempt to collect that phone. So I've got the SIM and I've got the contract for the SIM with Tesco's, but I haven't put the SIM in the phone because it's not been delivered yet.
There we are.
Right,
Doesn't that
so
look wonderfully rich and creamy and
Chromebook.
more importantly, I think it looks so inviting when it's like that. Oh, look at that. That's going to be
Samsung.
the perfect accompaniment to go with our buffalo
How to
chicken